much, guys. Thank you very much, guys, for joining us right here on Montanic Facebook and also YouTube Live. I'm Otto here, coming to you live from my room since we're still on lockdown. So we're going to be live just for a bit, and we have a special interview with our special guest for today. And just let me know if you have any comments. Let me know if you can hear me. Let me know. Give me a thumbs up. And then if you can hear me, is my visual okay? How is it skipping? Do you hear any popping during this live session here? Before we start, just let me know in the comment section. I will get to you as soon as possible. If there's any questions whatsoever at the end of this interview, we will definitely answer all the questions which you have. All right. So today, let me introduce you to a special guest that we have for today, Nizam. Thank you very much, Nizam. We have a special guest here for today. He has years of experience in a lot of things, especially when it comes to outdoors. Let me just read his credentials. Yeah. So Brandon Chee, he has more than 25 years of experience during outdoor education field. Now, one of the certificates which I think is very impressive is that he has a certificate in National Industry Expert. He has a certificate in Certified Master Educator, Leave No Trace. He's a certified trainer as well, certified wilderness medical instructor. He's certified wilderness emergency medical technician as well. And he's also a brand ambassador for Moranif, Sweden. So aside from that, he is a very nice guy to be with. He's very open. He's very friendly. Aside from that, Yi Yok Chuan, all good. Thank you very much. Let me see if I can bring you up there. Yes, thank you very much, Yi Yok Chuan, for joining us. All is good. We had Nizam as well. Thank you very much, Nizam. Okay. If you guys, since today's topic is all about first aid, outdoor first aid, I think it's very important that all of us know a bit about first aid. Like myself, I haven't been to a class in first aid for how many years? So I think I need to refresh myself as well. So this is a great opportunity for those who have no experience whatsoever when it comes to first aid, and particularly when it comes to breathing difficulties when you're going outdoors. So this is a perfect opportunity. So please share this live right now to your friends, your family, even perfect strangers as well. Just share it, because you never know what Brandon might give and share with us could be life-saving for somebody out there. So please share it right now. And before I enter him into the live stream, just let me say hello to all those who are here. Nazrul Ikram says hello. Hello to you, Nazrul Ikram. So once again, guys, if you just tuned in, please be sure to leave all your questions at the end of this session, just to make sure that I will collect all your questions during the end of the show. So you just type it out, and then we'll get to it one by one. Just type it out. All right. So without further ado, let me bring in the man himself, Brandon Chee, into the room right now. Thank you very much, Brandon. Brandon, can you hear me?
I can hear you, Otto. Hello, everyone. How are you? Thank you, Otto.
Oh my goodness.
The line is good, Otto.
Okay. Once again, can everybody hear Brandon?
Everyone can hear me?
Okay. Let me turn off my mic. Let's see what happens.
Hello, everyone. Can you hear me?
Okay. We can hear you. So
any popping sound?
There is a popping sound, but I think before we start, I'll turn off my mic so that you can proceed, and then we can continue with the first topic for today. Yeah. So let me see if there are any comments here. No. All right. So let's move on with the first question. Okay, Brandon Chee, thank you very much for joining us. So I have the basic question that I would like to ask, even I think everybody else would like to ask as well, is what is first aid outdoor, or even wilderness first aid? Can you please explain to us?
All right. Thank you, Otto. Thank you, everyone. All right. Quick one. Since we have limited time, so basically, outdoor first aid or wilderness first aid is something that is a first aid. Still, is a procedure of first aid, but you use it certain procedures in the wilderness, in the remote setting, which is you do some extended care to the patient, which is normally in a normal urban first aid that you don't do that. Okay, normally emergency you just pick up and then you send to ambulance to hospital. But in wilderness setting, our medical services is quite far. Okay, a few hours, maybe a few days, maybe. So we need to do more extended care, more procedures, more treatment to ensure to prolong, actually to prolong the life, the patient life. So that is in the wilderness setting. And of course, in the same time, also in the wilderness setting, also we use very limited equipments that we can carry along. So certain we need to do more observation, monitoring on the patient itself. Okay, today basically I'm going to share with you about respiratory distress, okay, or breathing difficulty, okay. We cover on this because I think this topic is quite important for this season now, COVID season as well. Okay, so I'm going to go through not really too deep in medical stuff, but it's very general. Okay, I don't teach you hands-on here, but I give you more on theory side. So if you have chance, then you can do more the theory part, I mean the practical part. Okay, all right. Let's go through. Basically, what is respiratory distress? Okay, it's basically breathing difficulty. If you want to see the slide, go ahead. Okay, or shortness of breath. Normally, people having difficult breathing or feel short of breath when they have trouble inhaling or exhaling. They don't enough oxygen. Okay, that they feel that. Some people they will after normal common people that maybe experience exercise, if you anxious, some cases you have a medical condition. Of course, this is another way, another area that we need to tackle. All right, respiratory distress, as you know, like asthma, you can get allergic or anaphylactics, heart problems. All these things are part or lung, all these things you make your respiratory distress. Okay, like very common, like another one is like when you have fever, example, it indicates also, especially your flu, indicates also you have maybe a pneumonia or some other lungs diseases or other things. Okay, all right, I will go through more. What is sign of respiratory distress? This is a lot here. Okay, normally we feel short of breath, chest tight. Choking is one of them also. This is under the airway obstruction. So we'll talk about it later. Okay, you might confuse. Your nose is very bigger, your nostril bigger. Sometimes you also have a running nose, sore throats, watery eye, wheezing, high fever, chill, cough, sweating, numbness, tingling, nausea, dizziness. Okay, of course, low blood pressure, you need to measure that. Okay, and then one very easy to identify is you're unable to speak a full sentence. Okay, very difficult. You feel that very difficult. Okay, of course, pale, and worse, you go for unresponsiveness. You're very bad. Okay, so this is signs of symptom of respiratory distress. Of course, there are more, some, but this is the common one that you need to watch out. You need to pay attention on this. All right. Let me see. Okay. Next one. This is a primary assessment of respiratory. Okay. In the respiratory systems, we cover two areas. One is the airway, one is the breathing. Okay. First one on the airway. This is important. Okay. If there are few things that can we need to check our airway, can block our airway, that make our airway problems. Okay. One of them is, first one is foreign body, a foreign object like food or teeth. Okay, stuck. Okay, stuck in our throat, example. So how we do that? We have few ways. One is we look for the obstruction. We can see, we can take it out. We take it out. Okay. Another one is ventilate. You ventilate them. okay, using a mask. Or you do what? Chest compression, for example, choking method, abdominal thrust, we call it now. Okay, so if you have something that obstruct you on the upper part here. Next one, on the airway as well, you check about fluid. Maybe you have blood, water, or vomit, stuck there. So how you take it out? So you got two way. This is the common way we apply in the wilderness or outdoor. Okay, but of course in hospital sometimes they do this. First one is gravity. What I mean gravity is we need to sideway, lie down on the sideway. Okay, like recovery position example. Then we let the fluid come up by itself. Okay. Another one, use suctions. You can use your syringe example, or you have a suction device. You can suck it up. All right. And then another one that can block our airway is things that we need to watch out is about position. Sometimes we when we unconscious or whatever, we bend like this or pull down like this, we cannot breathe properly. So we need to make it straight back. So normally we call it neutral position or supine position. Okay, we align the spine, we align back. Okay, lying down and face your face upward. Okay, so you align your spine basically. Another one, if position is not right, okay, or head position not right, you need to do jaw thrust. Jaw thrust is if you suspect the person got spine injury, you do a jaw thrust. Okay, open the jaw so you can breathe the airway, the air can in and out. Or you do head tilt chin lift, it's a normal one. Like example, when you learn CPR, you do head tilt chin lift, right? So you open your airway. So you can do that as well. Fourth one, that can make your airway problem is swelling. This is trauma, burns, or anaphylactic. Okay, this one a bit difficult when you want to do on the field. Okay, you can apply your BLS or ALS things. It depends on the problem. What problem, then you solve it. You use that whatever symptoms that occur, then you use the correct treatment to do. All right. So that's the primary assessments on the respiratory on airway. Now we go on the breathing. Okay, it's part of the respiratory system as well. In the field, we use this term called PROP, prop. It's very general treatment. Okay. First one is P, is position of comfort. Okay. So what is the best position for that patient to feel better? Of course, recovery position, one of the best one. And then certain position, sometimes sitting down, they sitting or laying back, they feel better. It's all right. You can use that. It's up to the patient. Okay. Another one is very important is the R, reassure. Okay, we need to calm down the patients, especially example like asthma people. They have difficulty of breathing very fast. Very shallow as well. So you need to slow them down. All right. So you need to talk to them slowly and then ask them to breathe in and breathe out. Follow the slow rhythm, deep, very deep. Inhale, exhale, inhale. Okay. So you guide the person, the patient. It's very important. Okay. By doing that, you reassure and then you give more confidence to the patient. Another one, of course, if you have oxygen, okay, if available, you need to give oxygen. That's the best. You can do your nasal cannula or or your mask. Fourth one, this is normally we don't want to use this, but if you're going to this situation, is considered very bad. Okay, this is positive pressure ventilation. Basically, we do a rescue breath. Okay, we blow mouth to mouth to the person. Okay, every 5 seconds, one breath, one blow. 5 seconds, then one blow. Okay, or you can use a pocket mask, or if you have a back valve mask, you can use that to press and give air to the person. So basically, PPV, positive pressure ventilation, normally called PPV, is basically we give, we help the person give a breath. We give a breath to the person. So we simulate that. So hopefully they can breathe by themselves slowly, right? Okay, treatment on the respiratory system. This is some other common, common one as well. Example of obstruction again. Let's say you have solid foods, liquids, all these things we use. Okay, let's say like solid, we use choking, chest abdominal pressure or chest compression or abdominal thrust. Okay, so can come up. Or liquids normally we do suction or gravity again. Position, we position again, and then of course like anesthetic, swelling, we give medicines, right? Medication. On upper airway, swelling on upper airway, lower airway. Like example, asthma, anesthetic, or infection, or irritate. We provide, we give, we do inhaler, use inhaler first, and then if we get more serious, we use epinephrine or Epipen, right? Or here in Malaysia, we use adrenaline. All right. Third one, if you have, this is inside the lung already. Okay, you have pneumonia, you have heart failure or drowning. You have hips, high altitudes, example. So normally we give antibiotics or altitudes medicines. Okay. All right. Chest. This is trauma. All right. You have a rib failure. You have a hole in your chest. You can hear some sounds. So normally we seal it, and then we do pain medications, and we support the injury part. Let's say on my left hand side, example, my lung got punctured, example, or fracture. So we use a towel, we put underneath our armpit here on the left hand side, and we wrap it up. So we feel more comfort. Okay, you need to be slightly tight, and then you feel better when you breathe. All right, and then the neurodrive. This is more detailed technicals a little bit. They call it stop it. It's a short form for that. So basically, if you have sugar problem, then we use sugar to solve it. What is it? Is sugar cause the problem, or less of sugar? Then we use that. If it's a temperature problem, if it's too cold, we warm it up. If it's too hot, we cool it down. Example. Okay. Oxygen. If it's oxygen problem, we give oxygen. Pressure as well, perfusion, blood coming out, we stop the blood, example. Okay, electricity, it depends on epilepsy. Okay, what's the cause of that? Altitude, is there altitude problem? If it's altitude problem, then we descend, example. Okay, is it a toxic problem? We need to find out. Or salt problem, we need to find out. So you find and then you treat the cause. Of course, you protect the airway. All right, so this is on the respiratory. And then last one, how to prepare your first aid kit. This is only based on for the respiratory problems first aid kit module, just for that particular segment. Okay, on our respiratory problems. Of course, you need to know the knowledge first. Okay, how to use it, when to use it. Okay, this is important. So basic inside your first aid kit for your respiratory module, you must have your antihistamine inhaler. If you can carry Epipen, why not? It's very good. Okay, pulse oximeters now is very good, very useful. Okay, you can check the oxygen saturation, and then of course your heart, your pulse as well. Okay, a small device, easy to carry, and you have CPR, Marshall. If you had, that's very good. It's a barrier now. Pocket mask. Okay, so this is something that basic you should have inside your respiratory first aid kit module. Then slightly advanced, if you have on the medicine side, antibiotic, pain medicines, of course, drugs is for professional people to use. Okay, on the equipment, if you have suction tools, okay, it would be good. Sometimes you can improvise using your string, a bigger string. You can do that as well. Put a rubber tube on that. You can suck up. OPA, oral airway kits, like a J tube. You put inside, okay, up to your throat here, so you have an airway, clear airway. Or nasal from the nose, rubber tube. You go all the way here. Stethoscope. If you learn how to use it, it'll be good. Back valve mask. If you have that. Also, back valve mask also is quite useful, especially when you're doing water activity. Example, okay, so it's very useful in case people drown. Example, you can use that. Oxygen. If you have oxygen, that's best. Either with cannula on the nose or mask itself. Okay. Now the blood pressure device, is quite small, easy to carry. I think it can be one of the basic stuff if you need that. So this sharing is very quick sharing. So not too details on some others very detailed. So I hope during this Sunday night you gain something, and I have a very short time frame. Okay, thank you so much. Any questions? Back to you, Otto.
Okay. Thank you very much, Brandon. I see that your connection is a bit popping, so I'm going to just before we answer all the questions that we have, could you please? I'm going to kick you out for a while. I'm going to kick you out for a while, and then try and come back in. Let's try and get some more clearer connection. All right. Okay. All right. So thank you very much, guys, for the questions. Let's take a look at while we wait for our speaker to come back in. Let's see, clear. Let's see who's this. Nazrul. Let's say hi to everybody who's here. We have Desiree popping sound. Yeah, Desiree, thank you very much for that comment. We're trying to see what we can do. We have Judy Chua. Hey, Judy, how are you? Let's see, who do we have also? We have Yi Yok Chuan. Brandon's audio is lagging in a way. Yeah. A technical issue. We're trying to see what we can do about it as of now. And then who do we have here? Can't understand much. John Sin Lo Hien Tella. Oh, no problem. If you have any questions, please do leave a comment in the comment section below. All right. And then we'll try to help you out in any way that we can during this session right now. So we don't have much time. We'll just get through everything. Tao Min Lim, Brandon voice is too soft and sound is breaking. Yep, we're facing that as well. We're trying to see what we can do about it. I'm gonna try to say, oops, late skit. No worries. If you have any questions, one more time. If you have any questions, please do leave a comment in the comment section. Breaking sound, yes, Jonathan. Yeah, definitely. A lot of issues. Go Ko Ming. Thank you very much. XL Chai. Okay, let's see, who do we have next? Desiree. Quite loud. All right. All right, Brandon, can you hear?
Yes, I can hear you. I still have some little. I hear some popping sound.
Sean Wong says the wording is too small to see. Don't worry. If you have any questions when it comes to first aid breathing, okay, you can always ask us right now in this comment section, and Brandon will definitely answer your questions. Let's see who do we have here. Tao Min Lim, maybe try using mic from headphone. You're using your onboard mic, right, Brandon?
Yeah, yes.
Hi, Derek. Oh, Derek's here. Sorry, lambat. Derek me. No worries, Derek. If you have any questions, please ask in the comment section. We have Sifu. The sound very, not very clear. Macam got disturbance. Yes, there's a disturbance in the force on Sunday.
Yeah, I don't know why. Right? Why when we test no problem, then suddenly got problem.
Yeah. Right. Yeah. Okay. So guys, one more time. If you have any questions, please do ask, and then I will try to answer your questions as soon as possible. We have like 6 minutes before we end this whole session. We have Tom and Lim. Can Brandon give brief explanation on how to use the recommended basic first aid tool? All right, I'll leave it to you, Brandon.
All right. We're talking about the first aid tools. Basically, the one that we talk about now is about the respiratory problem first aid kit module, only for respiratory, only for the breathing difficulty purpose. Okay, a pulse oximeter basically is to check your oxygen level, your oxygen saturation. Okay, at the same time also you can see your pulse rate as well. Okay, pulse oximeter is very good, so you can detect how much oxygen in your body. All right, like the example now, COVID things. If you are below 90, I think 92, you should go to hospital now. Okay, if you're below 92, or 95, you need to monitor yourself properly, and then below that you need to go to hospital. Okay, pocket mask. Pocket mask is like a mask. Okay, you used to do you give, like example, you use for CPR purpose, mouth to mouth, you use that, or you can also use for rescue breathing. You do PTV, okay, you give rescue blow to the person. All right. Antihistamine depends what symptom you have. Then you give antihistamines. Okay, inhaler is for asthma people, example. You need to shake it first before you use. Okay, and then upside down, you press, you suck, you hold for 10 seconds, the patient, and then you do 2 times or 3 times. Okay. Epipen is for allergic purpose mainly. Okay. You have allergic, anaphylactic, then you use Epipen. It's very easy. 3 steps only. You take up the cap, you punch to your type, and then you wait 5 seconds, 10 seconds, then you pick it up. Okay. The rest, like suction tools, it depends on your knowledge. If you have you go through some training, okay, you know how to do, then you can do suctions. Okay. Like oral airway kit as well. Okay, you use your J tube, so how to put in so you give airway to the person. All right. Of course, nasal from the nose. All these things require training. Okay. This is what the first aid kit I'm talking about is just for the respiratory problems. Okay.
Okay. All right. Next question. We have Derek, the camper. Sifu, after reopen, got first aid course to attend or not?
Yes, definitely. But of course, we need to be very careful also how to run the first aid course, because first aid course, most of the things require hands-on, and then we need to be very careful, especially on COVID now. So we will try to do definitely, but very limited people. Yeah.
Okay, thank you very much, Derek. Once again, we have like a couple 2 minutes left, so let's see who has here. Banda Anwar, hi sehat semua. Thank you very much, bro. Banda Anwar. All right, he's from YouTube. Mostly for questions from Facebook. So I have a question though. So your basic first aid kit, when it comes to just basic first aid kit, what should be inside that basic tool box kit?
Oh, you mean just about right? Basic one. Normally, basic one, you should have your wound kit. Bleeding, for bleeding purpose, stop the bleeding. Wound kit. To clean in the field, you don't have a chance to clean very very good, but you try your best to clean. But you should have your clean kit as well if you can. Okay. Wound kit is very important for bleeding. And then your normal like sprain, your ankle sprain, maybe your bandage, you should have that. And then of course, very normal medicines like Panadol, Diarrheal. This thing you should have. Okay. And then depends on you. Sometimes you have if you're an allergic person, you should prepare your antihistamines, and then maybe your Epipen example. If you're asthma, you prepare your inhaler, the kind of things. So it's very very basic. It's all depends your condition, your knowledge. You must know how to use it as well before you do your first aid kit.
Okay.
Okay. Yeah, that's important.
Okay. One final question. Charles Tim says, if go camping, what's the first aid thing you must have? Name 8 things or 10 things.
First aid. Another first aid thing is if you go camping, first aid things you must have. Let's say, okay, for me, I'll look at that. You must have your plaster, you must have your bandage, your triangle bandage, your Panadol, your diarrhea pill. What else? scissors, your sterilized crepe bandage, gauze. That is all important.
Iodine as well, is it?
And of course, you also like example, you have muscle cream. You bring along, and then insect bites, example, you bring along, and then for cleaning, of course, you have your antiseptic, all this thing. Yeah.
Okay. All right. Thank you very much for your time, Brendan Chee. Once again, it's been a pleasure to have you on Montanic's Adventure Channel, also on our Facebook page. Now, before we leave you, is there any advice or message that you'd like to give everybody as before we end?
Okay. Please stay safe at home. If you feel any breathing difficulty, okay, you need to really pay attention and see what kind of symptom you have, and try to do the basic prop treatments, and then you monitor from there, and then if you get worse, quickly go to the hospital. Thank you.
All right. Thank you very much, Brendan Chee, Master Educator in Outdoor Experiences. Thank you so much for joining us. Your time is very precious to us. So it's over 2 minutes past 30 seconds. Derek says, I just want to add, Tao Ming says, thanks, great show. Thank you very much, Tao Ming. We also have Derek Camper says, thanks, Chief. We look forward to attend your first aid. I would love to attend your course as well, Brandon. Let's see. Rich Gen Chill says, thanks for sharing. Okay, so thank you very much, guys. Thank you very much, Brendan. Stay safe at home, and hopefully that next week we can see some shops open, knowing how the situation is now currently. But anyway, follow all the SOPs. Remember to wear your face mask, social distancing. Everything is important when it comes to this pandemic here. So stay safe, behave, and until our next live session, take care, Malaysia. Thank you very much, Brandon. See ya.